everyone, my name is Dabbah. I go by Shay. I'm of ShayTheCoach, and I'm here with Dr. James Bogash of LifeCare Chiropractic. So the first thing I want to do is introduce him to you, what he does at his practice, and what this thing called PRP is, like I promised. So without further ado, hi, thanks for doing this. And so can you just tell me a little bit about yourself and your clinic, LifeCare Chiropractic?
Sure. I've been a chiropractor for just finished my 20th year, so starting the 21st year. Have always had a very strong focus on the soft tissues, so not just adjusting. A huge chunk of what we do is muscles. So muscles, ligaments, tendons, fascia, anything we can do to help the adjustment. I found that patients get better faster and stay better longer. So we've really hung our hat on that for the clinic for the entire 20 years I've been in practice. Also have a very strong background in research and nutrition. It's a huge passion of mine. And I read on the range about 120 medical journals a month, and I've done that for almost 20 years now.
Wow, that's great. So you're very passionate. You've been around for quite a while. Excellent track record. So you offer the chiropractic services here. What are the other services offered at LifeCare Chiropractic?
One of the things I found is that, let's take a knee for example, is that we do really well with knees. Even somebody who has degenerative arthritis and 3 visits later they don't have any pain left, we didn't really fix the underlying joint. It's just that the joint wasn't what was causing the pain. So when we started looking at adding a regenerative medicine into the practice, it was a perfect combination of what we could already do, and it just takes it to the next step. So we brought in techniques like PRP and stem cell to augment what we are already good with.
Okay, great. So the chiropractic, regenerative medicine, there he said it, the PRP and stem cells. So can we talk about PRP here today as the focus, and then obviously bring in whatever you're comfortable about stem cells. So what is PRP? What does it stand for?
PRP stands for platelet-rich plasma.
Okay.
And it is a process by which platelets, depending on who you talk to, contain tens, if not hundreds, of healing compounds, messages, hormones. It's why when we get injured, if we get sliced, these platelets go to the site of injury and they start to stimulate the healing. The problem is when we have an injury and that injury heals improperly, we no longer have platelets because it's not an acute injury anymore. And after we've had an injury and scar tissue develops, you have even less blood flow to that. Joint surfaces as well don't have a very good blood supply. So with the technique of PRP is we will draw off somebody's own blood, so just typical venous, like you'd be having your blood drawn to have labs done, and that blood is spun down at a specific speed, and you end up with that typical look where the top clear part is called the supernate, and you have a little white layer called the buffy coat, and the bottom is where the red blood cells pack down. So that clear liquid on the top is going to have a higher concentration of platelets, generally anywhere from 4 to 6 times as much as you would have in the blood itself. That clear fluid and a little bit of the buffy coat is drawn up and re-injected back into joints. So you have these healing factors that have been turned on by, it's called degranulation. It's a process that the platelets are turned on to start releasing these healing compounds, and re-injected back into an area that doesn't have those platelets at higher levels.
That's phenomenal. That's great. Thank you for that explanation. That makes sense to me because I've read about it and that research. Sometimes you can get lost in the scientific words. So that was really well explained, like in layman's terms, right? What is PRP? That's what it is.